from Lynch, and this is Lynch's Pharmacy Health video series. This video is on diarrhea. The most common type of diarrhea seen is acute onset diarrhea, which comes on very quickly within a few hours and usually involves at least 3 or 4 loose watery stools a day. There may be blood or mucus in the stools in the case of infections. If so, you will need to go straight to a GP for a closer look. Often diarrhea is associated with cramping pains in the stomach, a headache, possibly a temperature, aching limbs, as well as other similar symptoms. In most cases, diarrhea will ease and resolve itself within a few days. Some cases take longer. The most significant risk is dehydration. So the most important thing to do is drink plenty of fluids, and more so than you would in a normal day. Also, patients should eat as normal if possible. The advice used to be reduce the amount you eat if you were sick or had diarrhea, but now the advice is to let your stomach guide you. So if you're hungry, by all means eat. Nothing too heavy obviously, but by no means refrain from eating. So the most important thing is drink plenty of fluids. In terms of the causes of diarrhea, infection is by far the most common cause, either bacterial or viral. It could come from anywhere, most often food, but it can be caused by other things like drinking too much alcohol, the side effects of some drugs, even anxiety can cause diarrhea. Chronic diarrhea is a common factor with some disorders of the gut, and it can often be mistaken for acute diarrhea at the beginning. For example, Crohn's disease or ulcerative colitis would be associated with fairly severe chronic diarrhea. Vomiting often occurs with diarrhea. They often go hand in hand, so the vomiting shouldn't last more than a day or two, and then it will go away. But the diarrhea may persist for a few days before things return to normal. So it's important that you know this and understand this. So as I said, the most important risk with diarrhea is dehydration. Mild dehydration is common enough with patients who have diarrhea and who may be getting sick as well. If there are signs of severe dehydration, then the patient requires a referral to a doctor. Also, the individual is more likely to become dehydrated if the person is very young or very old. So both ends of the spectrum are more prone to dehydration than a middle-aged person or a young adult. So symptoms of dehydration would be tiredness, dizziness, lightheadedness, headache, sore eyes, dry mouth or tongue, and pass less urine. Very severe dehydration could result in severe weakness, confusion, even collapse, and would obviously require immediate visit to a GP for further investigation. So dehydration is more common in very young children and the elderly, so it is important that you're aware of this and act accordingly. If the person is a child or a mother who's visiting for or looking for information on behalf of their elderly patients or parents at home, this should be ascertained who the treatment is for. In terms of when to see a GP for diarrhea, I've mentioned most of them already, but it's the very young, infants and the elderly people. And of course, blood in diarrhea, obviously you need to go and see a doctor as well. In terms of time scales then, for an adult, if they're vomiting for more than 1 or 2 days, they should go and see a doctor. If they have diarrhea for more than 3 to 4 days, they should also go and see a doctor. For a child less than 6 months, if they have diarrhea for more than a day, they should go and see a GP. And if the child is within 6 months and 2 years or more and have had diarrhea for over 2 days, it's go to see a doctor for further investigation. I'd pay attention to the way the person with diarrhea seems overall, whether they seem like themselves. If it's a child, like are they limp, are they their usual selves, or have their personality changed? Are they quieter than normal? And I'd also use to judge whether the child needs a referral to a doctor. You can use this information. If you have any questions on diarrhea, you can contact me through the live pharmacist on the website, or you can email me or call into the pharmacy, Lynch's Pharmacy in Broaddale, up Maryborough Hill in Douglas. Thank you for watching.